Hi there, my name is Cody McGee.
Oh, hi, nice to meet you.
Hi there, I'm a student physical therapist and I'll be conducting an initial evaluation and interview with you today.
Okay.
And what that consists of is just going over some past medical history. We'll talk about what brings you in today, a little bit of details consistent of that.
All right.
And then followed by that, we'll do a little bit of a physical test to kind of see where your strength level's at, pain level, range of motion, stability, balance, those kind of things, coordination.
Okay.
So that all sound okay?
Sure.
All right, great. So just to start with, to begin, I just want to go over some quick medical history. Quickly, real fast, I just want to verify your name. I'm Melissa, is that correct?
That's correct.
All right, and what's your date of birth for me?
January 11th,
All right,
1956.
56, all right. Gotcha. And then Caucasian?
Yeah.
Yeah, okay.
Yeah.
Are you from here?
Yeah, for the most part.
All right.
Been here most of my life. Yeah.
Fellow Floridian, alrighty.
Yeah.
Good. Myself as well. And you speak English primarily?
Yes.
Yes.
Yeah.
Okay. Very good. Now tell me a little bit what brings you in today.
Well, my shoulder, I clean houses and things for a living, and so I use my shoulders a lot. And lately, this one's just been, I've lost my range of motion, and it feels like it gets stuck and it hurts, and it feels like somebody's stabbing like a knife in there.
I can completely understand. Well, why don't you give it a little break right now? I'm sure it's pretty painful. I'm sure.
Yeah,
right now.
yeah, it is.
So
at
careful
times.
with the certain movements. We'll be going over some movements that are good for it, that aren't going to disturb it. But for now, we'll leave it alone and not move the shoulder too much.
Okay, sounds
But the shooting pains you were mentioning, we'll jump back to that later.
good. Okay.
Now, are you getting a surgery, or have you had a surgery on it in the past?
I have not had a surgery on it. I was trying to avoid that, but I don't know. Whatever you all feel is the best.
Totally understand. Absolutely. So, have you had any images of that whatsoever?
I've had an X-ray.
X-ray? Okay.
Yeah.
And that came back looking okay?
As far as I know, yeah. They said that I'd have to have, X-rays don't really show everything. But,
Right. But as far as that goes, it looked pretty good.
Yeah,
with the
there's nothing broken or anything like that.
Good. Okay. Perfect. And when did this all begin?
Oh, I don't know. I want to say it slowly started over the last couple years. Excuse me.
So it's been something that's been going on for a while now, huh?
Yeah, it's just been getting worse.
Well, let's see if we can get your pain levels lowered and get you feeling good. Does that sound good?
That would be great, yeah.
Perfect. Well, I'm on board. We're going to try and do our best here to get you feeling good. So, jumping back a little bit further now, I just want to go over a little bit of a systems check kind of thing with you. So, we'll quickly go over some background. Do you have any history or your family history of cardiovascular problems whatsoever? Heart attack? Embolism, anything like that?
Not really, no, I don't think so. None that I know of.
Alrighty. And then blood pressure, high blood pressure, low blood pressure, anything like that?
Usually runs a little low.
Low blood pressure. Alright. And then are you getting medicated for that?
No.
No medication. Alright. And then cholesterol, how's your cholesterol levels? They looking okay?
I'm pretty sure they're alright.
Looking
I'm
good?
not doing
Okay.
too bad.
Doctors never told you otherwise?
No, not really.
No? Okay. Any lung problems with breathing or anything like that? Shortness of breath?
Occasionally get some bronchitis, going on because I used to be a smoker.
Okay, so we get maybe a little chronically, you think?
Yeah, maybe. I'm not really sure.
Alrighty. Neurological issues of any kind?
Not that I know of.
No? Alrighty. Skin? Any issues with the skin, rashes, pigmentation, nothing like that?
No.
No? Okay.
No.
Excellent. Joint or bone problems? Other than what we talked about, we mentioned the shoulder. You're in for that.
No, nothing else really.
No arthritis, anything like that.
Well, I mean, maybe a little arthritis it could be, but I've never had it, checked to see if that's actually what it was. But I'm assuming there's some arthritis in there. There's got to be at my age.
As far as the X-ray you got, though, it didn't show it at the time when you got that.
No, not at the time.
Not at the time. Okay.
Mm-hmm.
Any endocrine or hormonal problems whatsoever?
Mm-mm.
No? Okay.
No.
Gastrointestinal?
No.
Stomach problems of any kind?
No.
No? Okay.
Mm-mm.
Immune problems?
I don't think so.
Alrighty.
Nobody's told me otherwise.
And then other than the shoulder, any other problems with muscular myelopathies or anything like that? No?
No.
Okay. Shoulder's the first one, huh? Just got to the point where it's unbearable.
Yeah.
Okay.
Pretty much, yeah.
Completely understand. Any cancers or anything? Malignancies?
In the family or me personally?
Either.
I think cancer, some sorts of cancers run in my family.
Okay.
I want to say it's more so in the men in the family though, so it's not really probably anything I need to worry about.
Alrighty, but nothing for yourself as well?
No.
Alrighty. Any psychological problems or anything like that run into the family or that you've experienced yourself? Anxiety, depression?
No, not really. I mean, I get a little upset with myself sometimes when my shoulder doesn't work quite the way I want it to, but, that's about it.
That's pretty
Just like
reasonable.
anybody would.
Of course, that's reasonable. If the shoulder gets a little irritated, we get a little irritated. It's frustrating not being able to do
like
things.
Being hangry.
Absolutely. Right. Well, let's fix that.
That would be great. Yep.
Excellent. Any dependencies or any medications or anything like that? Alcohol, smoking?
No, I quit drinking some years ago. I stopped smoking, probably close to a year ago.
Alrighty.
That's about it, I think.
Well, congratulations on quitting drinking. That's a big one for you.
Yeah.
I'm sure you feel a lot better even after that.
Oh yes, I feel much better.
Good. Currently pregnant or past pregnancies at all?
Oh no, that'd be impossible.
Alrighty. And then current or past medications that you can think of that was prescribed over the counter?
Like ibuprofen.
Just ibuprofen?
Yeah.
Okay, nothing from the doctor.
Ibuprofen. No, prescription. Yeah. Well,
okay, gotcha. Just a little for the pain?
Yeah.
Okay.
Yeah. Just as needed.
Alrighty. Now, talking specifically about your pain that brings you in today, prior to you coming in here, and you mentioned that it was chronically hurting you in the past. What would you say your average level of pain was prior to you coming in, before it started elevating?
Well, I would have to say that when I first did it, it hurt pretty good. And then it kind of eased up some. And then it kind of settled maybe in a spot. And then it got comfortable there, and I kind of moved how I wanted to move around it to make it so it wouldn't hurt. And now I'm finding that I'm having more trouble with it.
Okay.
And it doesn't want to cooperate.
So at the time, on a scale of 10, do you think it was, where do you think it was at there?
It was probably a good 8 for a minute.
8, and then it kind of came down a bit.
Yeah. And now it's just, when you, out of the blue, you lift something wrong, or you spin the wrong way, you twist your arm the wrong way or something, and go to shake somebody's hand, and you know.
Right, absolutely. So kind of, do you think what brought you in mostly was so that the pain elevated initially? You said it came down, and then when it came back down, though, it didn't feel the same.
No, it definitely doesn't do the same stuff it used to do. Like, I can only lift my arm now like halfway.
Right, which you showed me is pretty much what you got.
about
Yeah,
there.
that's okay.
Yeah,
You don't
yeah.
have to show me anymore for now. We'll do a little bit in a
And
little
it
while.
starts to
here.
hurt right back over here. Yeah.
Yeah. Well, I'll help you move it so it doesn't hurt so bad in a little
Yeah.
minute here. We're not going to do anything that elicits the pain.
Cool.
Alrighty. So the pain's predominantly in the back of the shoulder there.
Yeah.
Right shoulder. Alright.
Yes.
And you mentioned that it's a shooting pain, shooting, stabbing.
Shooting, stabbing,
Alright.
pain.
Aching or anything radiating around the area, down into the arm, into the neck, anything like that.
Sometimes a little into the neck area.
Little-
Yeah.
A little into the neck. Okay.
Mhm.
Nothing down the arm though.
Well, yeah, actually, I get a couple little tingles in my fingers sometimes.
Little tingles in the fingers.
Yeah, kind of
Okay.
like they're going to sleep, but not.
Alrighty. Now moving on. Other than that particular pain, how are you feeling today? Given otherwise.
Well, I'm here.
Yes, we are. So we do what we can, right?
Yeah. No, I'm just, I'm to the point where I'm at that age where I'm just done with the pain. I just want to get something done, something going with it, and try to feel better.
For sure. We
So I
need
can enjoy my old age.
right. We need a little relief. Now, are you playing any
Yes.
sports or anything like that?
Oh, no.
No sports.
No, I
Okay.
swim in the pool sometimes
Yeah.
at the community center.
Okay. That's very good. Cool. I was gonna ask you about your exercising.
Yeah.
Now, you mentioned you're swimming. About how long are you doing that?
Not so much swimming because of my shoulder, but I bounce around the pool, and I hold on to the edge and I kick my legs and,
Very good.
kind of a little bit of water aerobics, but not, nothing major.
Good. About how long do you do that for?
There's a group of us that do it. We do it for
Okay.
about an hour a week.
About an hour a week.
Yeah.
Okay. Perfect. Group class, you said?
Mm-hmm.
Perfect. Now, jump into your home life a little bit. Are you living in a house, an apartment, assisted living facility, or anything similar to that?
A house.
A house? Okay.
Yes.
Great.
I own my house.
Perfect. Congratulations to that.
Thank you.
It's getting harder
Took a lot
out
of
there.
years.
Yeah, absolutely. How many people live with you?
Just me and my husband.
You and your husband?
Yeah.
Alrighty.
Yep.
Alrighty. Do you have any caregiver, or would you say that he's your caregiver kind of?
I'd say he's pretty much
Kinda,
my
sorta.
caregiver. Yeah.
When he needs to be, right?
Yeah. I think he pretends to be a little hard of hearing sometimes.
Yeah, that's what we're here for.
Yeah.
Nah. But any stairs or obstructions, anything like that? Like when you're going into your house, do you have to step down some stairs or anything like that?
I have a small step, maybe about that tall, to get in and out of my house,
Alrighty.
and one about the same, maybe to go into one of my hallways.
Alrighty. And then as far as like movements for the shoulder, do you have to do a lot of things in front of you or with the arms throughout the day? What do you do?
Yeah, I mean, I try and help my older friends and stuff by cleaning for them, and and a lot of them can't seem to mop and vacuum anymore. So yes, I do a lot of trying to push that back and forth all day long.
Alright.
At least it feels like all day long.
Right. So we're using that arm a lot then, is what you mean.
Yeah, probably more than we should.
Absolutely. Alrighty. Now, are you currently working right now?
Well, it's not really working. I just kind of help out my friends to try to keep myself busy.
Gotcha. Okay.
Yeah.
Gotcha. So no like full-time position.
No,
You're not
no,
doing
no.
like hours
Nothing
and
like
hours
that.
at a time. All the time.
No. Mm-mm.
Alrighty. Any repetitive tasks other than the ones we talked about that you find yourself doing throughout the day? A lot of sitting or standing.
I walk back and forth across the house as much as possible. It used to be a habit. Maybe it still is a habit. But I think sometimes maybe it's because I have nothing else to do.
Yeah, well, you know, sometimes it's nice to just get up and get the blood flowing a little bit.
Yeah, that too. Yeah, just keep moving.
Absolutely. Absolutely. Now, are you using any current assistive device to help you out around the house? Any kind of brace or any kind of walker or cane or anything like that?
No, I can't, don't really, I'm wearing flip-flops right now, but I try not to wear them anymore because I get a little clumsy with them sometimes.
Alright, so we avoid that. Yeah, that's probably a good idea. Just to, you know, to be on the safe side, of course.
But I like the way they look. We are in Florida.
Absolutely. Now, at this time, do you feel like you need the arm supported? Can you get it comfortable at this time?
Right now it's kind of just chilling there. I'm trying not to move it too much, but I mean, if I were to like lift it up, go to shake your hand or something like that, I would probably feel that pain back there. And if you actually put your fingers in there,
Oh, sure. Probably hurt a little bit.
hit a nerve or something in there,
Yeah.
whatever it is in there.
We'll do a little feeling around just to, you know, to assess the area, but nothing that's going to elicit pain like that.
Okay, good.
Absolutely. I don't
That
want.
sounds
We
good.
don't need to recreate any pain. That's no worries.
No, I don't really want to make it worse.
Absolutely. Any balance problems or coordination issues or stability problems that you've noticed recently?
No, not really, except for with the flip-flop thing.
Okay.
Like you said, you know,
Yeah.
sometimes they get stuck on the edge of something, and the only time I've really hurt myself was when I've gone to catch myself with that arm, the same arm, you know, that we're talking about, you know, and
Right.
you know, put a little more strain on the shoulder.
Absolutely. So we'll avoid those flip flops for now, just for safety. We don't want to fall on that shoulder. That's the last thing we want is to really do it in, just in case. You know,
Yeah, I agree.
Gotcha. Good. So now, what would you say your personal goals for rehabilitation are?
Well, I'd like to get it good enough so maybe I could learn how to play pickleball.
All right, there we go. Have you ever done that in the past?
No.
No? Okay. Pickleball. I hear it's pretty popular.
That's what I've heard.
Well, let's see if we can get that shoulder moving pretty good. We'll get rid of the pain first, and then once we do that, then we can start to work on some strength and stability and all the fun stuff that comes with it.
All right.
Full proprioceptive exercises, and then we can get you into a sport maybe. But we'll get one step at a time. We'll get you feeling good first.
Maybe one day we'll go dancing.
Maybe. Any additional concerns or complaints that you have at this time for me?
No, nothing really I can think of. That's pretty much it.
Perfect. So now what we're going to do is we're going to begin the physical portion of the assessment. Does that sound good?
Sure.
Perfect.
Yeah.
Alrighty.
Get her done.
Excellent.